So, good morning, everybody. We now have 4,531 positive cases of the COVID-19 at Albany County. 1,839 people are under mandatory quarantine. Again, a high that we haven't seen since the beginning. This is an increase of 68 positive cases, again, overnight. We have had 947 new positive cases since November 1st, almost 1,000, which is alarming. Our new positives for today, we had 20 people who had close contact to positive cases. 5 were healthcare workers. 1 person reported traveling out of state. 42 didn't have a clear source of infection. I guess it's better than 52 from the other day. So we have 19,112 people that have completed quarantine, and the positive cases out of that was 3,914 people that have recovered from the virus. We have 40 since yesterday. There's 37 people currently in the hospital. With one overnight hospitalization rate has dropped down to 0.81%. The day before, the rate was at 0.85%. Before this week, the last time we had 37 people in the hospital was June 1st. 9 patients are currently in the ICU. Yesterday, that number was 8. Over the last 5 days, the average has been 85.4 new positive cases each day. Before that, we hit the 91.6. There are some who say the only reason we're seeing spikes in positive cases is because we're testing more. While we're seeing testing at a higher rate, our percent positive rates are a better indicator of the spread of the virus. And our percent positive rates are very much too high. On November 11th, our percent positive was over 3%. On November the 9th, it was at 5.4%. On November the 8th, it was at 4.7%. Most recently, our average over the last 7 days has been roughly 2.98%. And keep in mind, in order to be considered a microcluster for Albany County our size, you need a 7-day rolling average of above 3% for 10 days, and then it resets. We've seen this already being done by Governor Cuomo in other parts of the state, down in Orange County, out in Erie County, different cluster zones, and we've talked about that, how you get different zones and the different requirements that are met for each zone. And if you just seen New York City was close to closing its schools and going virtual, but they were lucky enough the last couple of days to have low positive cases so they can stay open. That would be the same approach here if you hit yellow zone and so forth from there. So we're not quite there yet, but we continue to monitor this data. We need to do more to get our numbers moving in the right direction, and we've seen that when we had 147 and 60, and I think Liza and I can both say this. We used to go crazy over 10 or 12 or 15, and when 60 feels like a norm, there is something wrong. And I've even said that to my staff when we're like, oh, it's 60. Well, that's a really high number still. We need to continue to do the right thing, stay 6 feet apart, continue to wear your mask, cough into your arm, and can continue to clean your hands. And we'll get through this, working together in a partnership. So some of the things we've been working on in Albany County is the different partnerships we're doing with the school districts and Whitney Young. We continue to partner with Albany High School and a variety of schools to do rapid testing K through 12 with students. You know, it's a new requirement the governor put out. So working together to get that done, we will be announcing some of the partnerships today, and then I'll be showing you a couple things on the smart board. But parents can start booking test appointments today if their child is sent home or has symptoms because of a negative test if it needs to go back to school. So one of the things, the students who received negative results from the rapid test will need to get a follow-up confirmation with a PCR test, which is the lab results. So even if you go and you get the rapid test and it comes back, nothing detected, then you still have to get the other test done. They'll send it out. They'll do both. So the interesting thing was on Saturday, I do continue to get tested because of being out there and being around people, even trying to do the right thing and wear a mask all the time. So I went to one of them, and I went to the Central Med Urgent Care on Central Avenue, and it's pretty basic. This is all they do is just give you a thing back, says not detected. You go in there, you take the test, and you gotta try to make an appointment, but you show up and they'll get you in there, and it's pretty easy to get a rapid test. Takes time. It's there for a couple hours, so you gotta be patient. They have a lot of people coming in, but still, the students have to do it both ways, especially if they have signs and symptoms. They got to get both tests done, and Dr. Whalen can talk about that a little bit more, but under the executive order, that's what they have to do to continue. But it helps us if they get the rapid test, it comes back negative. It's less investigation work we have to do for that time being with all the students in the class until the other bigger test comes back within hopefully 3 days. So in order to get results and get students back to school as quickly as possible, this will only be available for students who are required to get the test in order to return to class. We're going to be able to schedule 8 tests per hour. Since results take about 15 minutes to get back, people should dress for the weather accordingly, the students, and we'll be using our mobile walk-up testing sites for this initiative, and testing location hours will be posted to the Albany County and Whitney Young website. All testing will be done by appointment only for K through 12. School staff will be coordinating the testing with parents, and there's a separate number that is different than the one we normally post for Whitney Young. All new testing locations will be Albany High School will be one of them, so we'll have a testing site at Albany High School, and we will have one at Cornell Cooperative Extension in Voorheesville to make it more convenient, because it goes for all the schools in Albany County, and obviously we'll have to expand on that, and we're talking to other places that can do this rapid testing for us to get it more convenient for all the parents in Albany County to get to. So for the Albany County adults and for the children who do not specifically request a test to go back to class, that's going to be an issue. But if they want to get the kids back in there and it helps, and Dr. Whalen could talk better about this than me, it makes it easier on her people to do their job if they do get the test and it comes back negative, and we hope it comes back negative. So it's less work that they have to do to trace it down and investigate it. So we do hope the parents will help us with this, which is why I'm excited to announce most recently upgrade to Albany County website, and why we have the smart board today here with us. There's a new map that the features will make it easier than ever before to locate the different testing sites, whether it's Albany, Whitney Young, Price Chopper, Walgreen, or any other location. One of the biggest questions I get hit with all the time, if I'm walking down the street, where's the rapid testing? And I'm like, all right, yeah, go to Walgreens, go here. Even though I say it every day, it's going to make it easier for people to go on the website and to locate it. You'll be able to see the one that is closest to you, which is the ones that provide testing for children. The average wait time, which is another big question I get for the results, and what type of symptoms you need to get tested. So I'm going to demonstrate it and show you on the smart board what we did. So if you go, and as you know, you go on our website, you can hit this up here, and it brings up our dashboard that Dr. Whalen and I go over all the time. But you hit there, and then you got the different sites you can go to, and you go to testing and results, and you put that on there. And the cool thing about this is that it shows you all the different sites that you can go to in Albany County in blue, and and then you can even break it down to where's the rapid testing, different areas that you can pull up that just do the antibody testing, and it's just all simple with a click of a button, and it makes it so much convenient. And again, you just go to the testing results. That's all you got to do to pull that up, and and then just go through this, and then you click right here, and it just shows it, and you can take that out and you go to the rapid PCR testing, and you can click that. And it shows you the different areas in a different color, and you can take that out if you want to. and then you can go to rapid, other testing, or antibody testing. It's all in different colors. It makes it simple for people to navigate. And again, you just got to hit the little icon in the corner to figure out what you're looking for, where it's at, and you pull it up. Or you can just, again, take it down to where you want it, and the rapid testing, hit it again, and it's going to show you. And then it pulls up what it is, where the business is, the address. It says wait time 15 minutes approximately, so it makes it pretty simple. Testing for kids, yes. Appointment needed, no, but you can call the number if you'd like to make an appointment, and it tells you the nasal swab provided and everything else, and it gives you the picture of the outside of the business. So please, by all means, go on here, utilize it. It's friendly, it makes it easy, and that's what we're trying to do to make it convenient so we can go forward and help people get it there. So again, you can see it's easy to navigate. Gives you all the numbers in the websites that you have to go on to make your appointment. So I encourage people to utilize it, and I want to thank my staff for putting that together. It took a little bit of time, but again, it's going to be great technology that's going to make it more convenient for people, and especially wait time, because I know, listen, everyone feels the same way. You don't want to walk into a place and have an hour wait, 2 hours wait. So, and then if you're concerned about the cost, UAlbany does it for free. They've been continuing to do it for free. And Whitney Young, we pay for it if you don't have insurance. So we do pay for the testing, so don't worry about that. But you can call UAlbany again at 1-888-364-3065, or Whitney Young for testing that does cover kids, for appointment at 518-465-4771. Dr. Whalen.
Good morning. So we are pleased to announce this partnership this morning with Whitney Young to be able to do testing of children that are excluded from school. As you know, Whitney Young has been partnered with us since the beginning of the pandemic in an effort to increase availability for testing, particularly in our South End and West Hill neighborhoods. And this collaboration enables them to also assist with the challenge that parents face when they are have their child excluded from school and need to get testing done. It's important to note that this testing will be separate from the testing that we usually have on our website, although that is still available for children as well as adults, and people can call and schedule via that mechanism. But this is a different mechanism of notification for testing, or the need for testing, and it will be through the school nurses. I think last week I had discussed with all of you that I would be having a call with the superintendents, which I did on Friday afternoon, and we covered a lot of topics. I can't say how impressed I am with how hard the schools have been working to ensure the safety of the students, the families, and the staff that they work with and serve to try to prevent the spread of COVID-19. And we continue to work with them around making sure that kids can get back to school and be tested in a prompt way. So this availability is for a child to have a first rapid test, and then if the rapid test is negative and they need a confirmatory PCR, this can be done at the same appointment. But I would encourage parents not to call Whitney Young about this. This will be coordinated through the school nurse, and the school nurse will provide us with a list of parents that have indicated that they would like their child to be tested, and then Whitney Young will reach out to you to schedule the appointment. So that is a little bit different than the process that has previously been set up, and we hope that this additional capacity will enable parents to be able to get their children tested quickly and appropriately. And again, appropriately means that if your child is symptomatic, they will ultimately need a PCR test unless they test positive through a rapid test. So we know that rapid tests are reliable for positives and not so much for negatives. But in the situation where your child gets a rapid test and needs a confirmatory PCR laboratory-based test, this is a good alternative and a good option. And I want to thank Whitney Young again for their ongoing commitment to working with the County Health Department and the County Executive's Office to ensure that we have availability for testing. The test sites that were just shown on the website will continue to be updated as we have more availability of test sites going forward, but hopefully this tool will also help the public know when and where to be tested and enable that to happen as quickly as possible. I wanted to mention, last week I did talk a bit about our Medical Reserve Corps, and I want to really thank people that reached out. We had a lot of people that have reached out to us, and we're in the process of reaching out to small numbers at a time. But the response has been wonderful, and I want to thank the public for their commitment. Last week at the Health Department, between Wednesday and Friday, we started getting some concerning number of calls from people that indicated that they felt they had been identified as contacts and had not had a reach out. This was unusual, so we went to work to try to determine what the cause of that was and whether there was a systemic problem that we needed to deal with. The County Health Department, as you know, is responsible for case investigation of all positive cases. So if a case has a laboratory confirmed or a rapid test positive, we reach out, we determine contacts, and the contacts are then turned over to the VCC, who is the workforce that works for the State Department of Health, who then is in contact with the contacts to advise them about quarantine. And what we heard about was that people weren't receiving those calls. So we contacted our partners and did an investigation and determined that there was a significant amount of contacts that had been sent back to us because of a glitch in the data collection. This was identified on the 14th, and 486 contacts were pushed back to the local health department. We worked very quickly and fixed the glitch, and we're told that by today, all of those contacts should have outreach. This was the first time this has happened. It was a problem with the system that has been rectified. I want to reassure the general public that this is not a sign that we are unable to keep up with the work that we need to do and that we're committed to continuing to do. It has been rectified and it has been remedied, and all of those individuals should be having a reach out by the end of the day. I do want to thank partners and members of the public for contacting us and making us aware of these concerns, because it did enable us to immediately go in and determine what the problem was and then do what we needed to do to rapidly fix it. And I want to thank my team at the health department for making that happen in very short order. Again, we at the Albany County Department of Health have the most dedicated staff. Every single day, these individuals have been working since the beginning of February in preparation and response for the pandemic, and I cannot say how impressed I am with their work ethic, with their commitment to excellence, and their ability to respond the way that they have and to expand the hours, their capacity, nonstop. We have staff that haven't taken days off in a long period of time, even though they know they can, and they're encouraged to. I don't want you to think me or the county executive are holding people's feet to the fire. They're doing this because they want to, because they're that dedicated, and because they know that that their response and their work makes a difference. So I am very proud to work with the staff that I have and to see the work that they put out to the general public every day. Even with 66 cases, these are still numbers that we have not seen the likes of since March. And we are still advising everyone to be on their guard and to remain cautious and to practice appropriate protective behaviors going forward to prevent spread in the community.
Thank you, Dr. Whalen, and I appreciate that. As always, the partnership with all of our departments in Albany County and the hard work everyone's doing, but especially your department, so thank you. A little bit of good news given in the situation that we're in. We did get some answers back on the control room call based on what we were hearing from Albany Med and other regional hospitals. It does look like the severity of hospitalizations aren't as bad this time around compared to the spring, which is good news. Hospital and ICU stays on the average are shorter, which we've thought for a while, or I did, I should say, that they were going to be they were longer, but they're saying it's shorter. However, they are admitting more people than they are discharging, so that's something we need to monitor going into the future. But again, I want to get them answers out there because that was the one question we kept getting hit with on Facebook and other means. So please, by all means, if you need mental health support, it's available 7 days a week, 8 a.m. to 5 p.m., and it's the number is 518-269-6634. Our 24-hour sexual assault hotline number, as always, 518-447-7716, and 211 in New York State hotline. Again, please continue to do the right thing. Be a partner in this. Help us get through it. Stay safe out there.